What I'm about to show you with regards to hip pain is stunningly effective, and actually I've had many patients come in saying they've got arthritis in their hip, they've had an x-ray, they're due to have a hip replacement in 3 months, 2 months, 1 month, whatever it may be, and we've started doing this treatment on them and they've actually ended up to the point where they've gone, there's no pain, it's all gone, and actually we don't have to have the hip operation anymore. So what we need to do is we need to understand what's causing the pain in the hip. Even if you've got arthritis in the hip and you've had an x-ray showing you that, that doesn't mean that you're guaranteed to have the hip pain, or that the hip pain you're getting is guaranteed to be coming from the hip joint. Think about it. There's plenty of 70 and 80-year-olds with no hip pain, but they've definitely got arthritis in the joint. So actually, arthritis doesn't always equal hip pain. So what do we do to get rid of the pain? What we do, we need to understand where it's coming from. A lot of hip pain is coming from a muscle that goes across there down to here. It's called the glute medius muscle, right in there. It's in this area, there, all around the side of the hip. People often describe to me that they get pain lying on their side at night. Every time they take a step, they get pain shooting into the side there. And I simply lie them on their side with this side up and I press into this muscle. And they're like, whoa, that is really painful. And if that's the case, I think great, because I think we can do a lot of good with that hip. So what we're going to do, we're going to release off this glute medius muscle, get more blood flow back into it, release off the tightness in this area, and get yourself feeling and moving a lot better. You may find after we do this, you're still left with a bit of hip tightness, hip pain, because maybe you do have some arthritis and maybe that is causing some symptoms, but hopefully this is causing the majority of your symptoms. And if this is the case, the tight muscle I'm talking about, then when we get that released off, you will start to feel and move a lot better. So let's get into the exercises now. There's 2 of them. So what I want you to do is get a tennis ball, and you're going to place it on the floor and you're going to simply lie on it. So it goes here and then you move over so the ball is underneath your hip. And then you put some pressure into it. Now then you move around until you find a super painful area in the hip, and you hold it there very still. You hold it still until that pain drops down. And then when it does, move around, find a new area that's painful, keep the pressure there, hold it very still, and then again you feel the pain dropping down. The key thing is that you're finding this tight muscle in the side of the hip, you're getting pressure into it, lots and lots of pressure with the ball. You might need to go around to the back more, to the side, move around till you find the really sore spot and get a lot of pressure on it. As you keep the pressure on it, the muscle will relax gradually, blood flow increases, the nervous system desensitizes in the area, and you're basically getting that muscle to release off to get yourself feeling and moving a lot better. Once you've done that, the next exercise is this. So you're going to start to strengthen the muscle. Simply lie on your side with the painful side up. And then what I want you to do, I'm doing it on the other leg, obviously, because I'm in this position for the camera, but this leg, you're going to lift up all the way, high as you can, and down. High as you can, all the way up, and down. All the way and down. As many as you can until you feel that burn building up in this muscle, and then you rest for 30 seconds, and then do the exact same thing again. All the way up, high as you can, and down. Do 3 sets of as many as you can. You might even find it quite beneficial, rather than leaning back, is to actually point your toe down slightly. So you're internally rotating, pointing your toe down, and then do the movement. You'll really activate that glute medius muscle if you do that. So those are the 2 exercises. With the ball, I want you to do 4 to 5 areas throughout that whole hip every single day. And with this leg raise, I want you to do 3 sets of maximal repetitions, and that is going to 1, release the muscle, 2, strengthen the muscle and get you feeling and moving a lot better.